Tips to treat GERD. What is GERD? Gastroesophageal reflux disease, GERD, is a condition that develops when there is a retrograde flow of stomach contents back into the esophagus. Here is esophageal sphincter is closed, but an other side esophageal sphincter is open and reflexing back food into esophagus. Factors involved in gastroesophageal reflux disease, GERD. Rather than specific food items, large meal volume and high calorie content can increase reflux burden. Sleeping on the left side and with the head end of the bed raised can reduce nighttime reflux. There is a causal link between obesity and reflux, and weight loss reduces symptoms. Alcohol can exacerbate reflux symptoms, although a direct cause and effect link has not been established. Eating fast can cause more reflux than eating the same meal volume slowly. Dietary adjustments and lifestyle measures can be helpful. Meal components. Meal components that delay gastric emptying, stimulate acid secretion, or increase sensitivity of the esophagus to reflux are likely to worsen the severity of reflux and/or reflux-related symptoms. Chocolate. Fried and spicy foods are often mentioned by patients as inducing reflux symptoms. However, well-controlled studies reveal little impact of these specific items on objective measurements of acid exposure. Sleeping pattern. Not only what we eat, but also how and when we eat can affect GERD. The speed of eating has effects on gastric function, with a meal consumed within 5 minutes causing significantly more reflux than the same meal consumed over 30 minutes. Individuals should avoid meals at least 3 hours before bedtime. Sleeping on the left side and with the head end of the bed raised can reduce nighttime reflux.